I'm Dr. Dhwani, and as we all know, it's October and it's Breast Cancer Awareness Month. Well, do you know that breast cancer is the most common cancer amongst Indian women? Every 4 minutes an Indian woman is diagnosed with breast cancer. In fact, 50% of our patients, when they come to show us for the first time, are already at an advanced stage. So the best protection for breast cancer is early detection. If you know the symptoms of breast cancer and are aware about the precautions and the screening protocol for breast cancer, it really helps. So what are the symptoms of breast cancer? Well, if you notice any changes in the size or shape of your breast, any changes in the skin over your breast, or any abnormal discharge from the nipples except while breastfeeding, or any appearance of any lump in your breast or in your underarms, you must see your doctor and get yourself examined. So which women are at an increased risk of getting breast cancer? Well, your family history is very important. If any blood relative has had a history of breast cancer or ovarian cancer in the past, definitely increases your risk of getting breast cancer. Women who have had an early menarche or a late menopause are also at a high risk of getting breast cancer. Women who are taking hormonal therapy or who have had a radiation exposure to their chest also are at an increased risk of getting breast cancer. So how can you reduce your risk of getting this breast cancer? Well, maintaining an ideal body weight, exercising regularly, breastfeeding your newborn, and awareness about the screening protocol about breast cancer really helps to reduce your risk of breast cancer. So how do we screen for breast cancer? Well, the most basic level of screening for breast cancer begins at home. It is the self-breast examination, which has to be done every month once your periods are over, and it can be started at 20 years of age. You have to stand in front of the mirror and look for any visual symptoms which I have mentioned before, and palpation of the breast has to be done to look for any abnormal swellings or lump in the breast. The second level of screening is the clinical breast examination, which has to be done once in every 3 years by a health professional. For women who are more than 40 years of age, it is recommended to get an annual mammography done, which is an X-ray of the breast. For women who are at high risk, it is recommended to get an annual clinical examination by a health professional every year. And in fact, mammography should be started at 35 years of age annually. Well, just like in this pandemic, we've noticed that how if I wear a mask, I protect you, and if you wear a mask, you protect me. Similarly, the same concept should be applied in this breast cancer screening, and we should educate and make our friends and families aware about the screening protocols and encourage everyone to come forward and get themselves screened for breast cancer to reduce the chances of getting cancer and early detection and hence the cure. Thank you.